Clinical Pharmacy Adherence Optimization, Part 2. In the previous video, I discussed definition, factors, and facts we have to consider while dealing with non-adherence to pharmaceutical care plan. While in this video, I will discuss non-adherence as a behavioral disorder. Before I start, I would like to give a message to all clinical pharmacists. In order to improve adherence to pharmacotherapy and hence to improve health outcomes, you must assess each patient individually, then provide targeted interventions that are responsive to his or her unique risk factors and needs. In the patient-centered adherence paradigm, the pharmacist integrates information about the following. First, patient knowledge of the medication. Second, the patient beliefs, values, and attitudes towards his or her illness and its treatment. Third, the patient ability and motivation to follow the regimen, skills, and willingness to perform. Non-adherence remains a problem of epidemic proportions. Non-adherence has been studied widely by behavioral scientists using models such as the health belief model and the theory of reasoned action, attempting to explain and predict non-adherence. Another alternative model that can be useful for understanding and treating non-adherence is to view the problem as a disorder, a behavioral disorder. Although non-adherence is not considered as a true physiological disease, non-adherence shares many of the same characteristics as a medical disorder. There are numerous risk factors for non-adherence have been identified. Non-adherence is a multifactorial problem and a host of contributing social, economic, medical, and behavioral factors. Some risk factors for non-adherence related to the disease itself. For example, if the patient has a chronic or asymptomatic illness. Other factors related to the patient, such as forgetfulness, sensory impairment, and economic problems. Other factors related to the drug regimen, concerns about cost, real or perceived adverse effects, or dosing schedule. Can we assess and monitor non-adherence? Yes, we can. A variety of direct and indirect methods are available to assess the presence and severity of non-adherence. As a pharmacotherapy specialist, pharmacists may be the best suited of health providers to evaluate adherence problems on an ongoing basis. Effective interventions are available to treat non-adherence. Many cases of non-adherence can be treated with carefully selected interventions. However, other cases may not be resolvable, despite the best efforts of healthcare providers. Non-adherence frequently leads to increased morbidity and mortality, just as untreated medical disorders often progress to serious complications. Non-adherence has a well-documented adverse impact on health outcomes. Non-adherence tends to have a variable course. Non-adherence is not a stable condition, but tends to progress or change over time in a given patient, just as most chronic medical conditions require periodic re-evaluation and therapeutic adjustments. Patients with adherence problem also should be reassessed on a regular basis. In the next video, I'll tell some examples about treating or dealing with non-adherence problem. Thank you and wish you a good luck.